In hospitals, there are many situations where a patient must be transported immediately, for example, road traffic accident cases, critically ill patients, inter-hospital transfers, emergency referrals. In these situations, an ambulance is not just a transport vehicle. It is actually a mobile life support unit. If the ambulance is not properly equipped or the staff is not properly trained, patient safety can be seriously compromised. That is why NABH introduced the COP-3 standard for ambulance services. What you will learn in this video. In this video, we will understand what NABH COP-3 standard says, what assessors check in ambulance services, common mistakes hospitals make, and how hospitals can become COP-3 compliant. Let's begin. What is NABH COP-3 standard? The COP-3 standard states, ambulance services ensure safe patient transportation with appropriate care. In simple words, hospitals must ensure safe patient transport, appropriate medical care during transport. This means the ambulance must be properly equipped and properly staffed. Objective elements of COP-3. The COP-3 standard includes several important elements. These include availability of ambulance services, proper ambulance access and parking area, ambulance equipment and vehicle fitness, trained ambulance personnel, daily ambulance checking system, communication system, pre-hospital emergency care. During NABH assessment, the assessor verifies these through ambulance inspection, document review, staff interviews. Access to ambulance services. Hospitals must ensure ambulance services are available according to their scope of services. These services can be in-house ambulance, outsourced ambulance service. But the hospital must ensure timely and safe patient transportation. National Ambulance Code. Ambulance services must follow the National Ambulance Code, AIS 125. This code defines types of ambulances, equipment requirements, patient transportation standards. Hospitals must select the appropriate ambulance type according to their services. Ambulance parking and access. Hospitals must provide proper ambulance access areas. This includes easy entry and exit route, dedicated ambulance parking bay, clear signage. Ambulance drivers must be able to quickly locate the emergency department. Ambulance vehicle requirements. Ambulance vehicles must meet statutory requirements, including valid registration as an ambulance, valid fitness certificate, pollution control certificate, vehicle insurance. These legal documents are verified by NABH assessors. Ambulance equipment. Ambulances must have basic life support equipment, such as oxygen supply, suction apparatus, blood pressure apparatus, pulse oximeter. Depending on the hospital's scope of services, additional equipment may include cardiac monitor, defibrillator, ventilator, emergency drugs. These should be available for both adult and pediatric patients. Trained ambulance personnel. Ambulance staff must be properly trained. The ambulance team may include driver, emergency technician, nurse, doctor. Proper training ensures safe patient handling and transport. Ambulance staff training. Ambulance personnel must receive training such as basic life support, BLS, cardiopulmonary resuscitation, CPR. These skills are essential for life-saving interventions during emergencies. Daily ambulance check. COP-3 requires a daily ambulance checking system. Daily checks include vehicle functioning, medical equipment functioning, emergency drug availability. These checks must always be documented. Vehicle function check. The daily vehicle checklist should include lights, siren, beacon lights, fuel level, tires. This ensures the ambulance is ready for emergency response. Medical equipment check. Ambulance equipment must also be checked daily, including oxygen cylinder level, suction machine, patient monitor. This ensures all equipment is functional during emergencies. Emergency drug check. Ambulances must carry emergency medications. Daily checks verify drug availability, expiry dates. If medications are used during a trip, they must be replenished immediately. Medication kit sealing. Some hospitals follow a sealed emergency drug kit system. In this system, emergency drug kits are sealed. After use, they are checked and resealed. This helps maintain drug accountability and readiness. Communication system. Ambulances must have a proper communication system. They should remain connected with hospital control room, emergency department. Communication tools may include mobile phones, wireless communication systems. Ambulance call process. Hospitals must have a written SOP for ambulance calls. This SOP should define How ambulance calls are received, response team identification, transport arrangements, response time. Hospitals must ensure that the ambulance is dispatched within a predefined response time once a transport request is received. Quick response is critical for patient survival. Pre-hospital emergency care. One important element of COP-3 is pre-hospital emergency care. This means treatment may begin before the patient reaches the hospital. This can significantly improve patient outcomes. Pre-hospital information collection. Before dispatching the ambulance, important patient information should be collected, such as patient age, patient weight, provisional diagnosis, current treatment. This helps the ambulance team prepare better before reaching the patient. Communication during transport. During transport, ambulance staff may remain in continuous communication with hospital doctors. This allows real-time clinical guidance, early emergency intervention, external ambulance cases. If a patient is transferred through an external ambulance service, hospital doctors may communicate with ambulance staff to understand the patient's clinical condition. However, transport decisions are taken by the ambulance medical team. Common NABH non-conformities in COP-3. During NABH assessments, common non-conformities include incomplete ambulance equipment, ambulance checklist not maintained, emergency drug expiry monitoring missing, ambulance staff training records not available, communication system not documented. Hospitals should address these gaps to avoid assessment observations. How hospitals can become COP-3 compliant. Hospitals can comply with COP-3 by following National Ambulance Code AIS 125, standardizing ambulance equipment, maintaining daily ambulance checklists, ensuring ambulance staff training, implementing communication SOP. These steps help hospitals effectively comply with NABH COP-3 requirements. In the next video of this NABH training series, we will discuss COP-4 mechanisms for patient care during community emergencies, epidemics, and disasters. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is Medi Quality Partners, your trusted NABH guide. Thank you for watching.